Our guest today is Scott Trevithick from the Sanford Center for Aging, and Scott's main purpose at the Sanford Center for Aging is to work in the volunteer program, getting volunteers for such programs as RSVP. Tell us about the Sanford Center generally and your role in the Sanford Center.
You bet. Sanford Center for Aging at the University of Nevada has been around for many years, named after Gene and Graham Sanford,
Right,
who are benefactors of the program through their estate gift. We're involved in outreach and education and research related to Nevada's seniors and affecting other seniors as well. RSVP is the program I'm director of. That's Retired and Senior Volunteer Program. Our mission is to improve lives and strengthen communities by engaging folks 55 and older in volunteer service in the community.
What are these volunteers doing? Is it pretty much one-on-one with other seniors in the community?
The great thing is we have many partners, over 60 different partners in the community, nonprofits and government agencies. So with a great variety of opportunities, our aim is to match the interests and skills and experience of volunteers with a particular program that benefits folks in the community. Some of our biggest programs, or the programs with whom we have the most volunteers, are Senior Auxiliary Volunteer Effort, the folks who work in community patrolling with the police department for Reno PD, and then also a program with seniors called Senior Outreach Services. Folks there are paired one-on-one with clients who are 60 and older and wishing to remain independent in their own homes but need some assistance to do that. So these folks provide supportive companionship and visit once a week, and then may help with essential errands like doctor's visits and that sort of thing.
And how are clients, you mentioned clients, how are the clients sent to you?
In that particular program, most often referrals through social service agencies, social workers at the hospitals, for instance, and then just generally a lot of community outreach. Speaking in the community at various clubs, as I got to know you, for instance. And we have communication through our website, through publications like Senior Spectrum and Generation Boomer, and then just word of mouth through referrals from our own volunteers, from the program leaders of our partners, and just being available in the community.
You're not part then of the foster grandparents program, which has been so successful.
It's related. We're funded by a federal program called the Corporation for National and Community Service, as is Foster Grandparents and Senior Companions. So RSVP, Foster Grandparents and Senior Companions, are all part of what they call their Senior Corps programs, all different ways to engage older Americans in service.
Give us a little thumbnail, if you will, Scott, on what the volunteers actually do as a senior companion.
That's with the SOS program, or Senior Outreach Services. They visit once a week. We have about 150 volunteers in that program, and they're reaching out to 250 to 300 different clients of that program, visiting them once a week, perhaps an hour or two each week, checking on how they're doing. They don't do medication management or personal care or financial management, but provide, like a neighbor would,
Transportation sometimes?
Transportation is a big need for doctor's appointments and other essential errands. And again, the goal is to help them to remain as independent as possible. That's what they wish as individuals, and from a community standpoint, it saves money by delaying or avoiding institutionalized care.
How can people that may want to volunteer become interested?
In that program, there definitely is. What can be discouraging for volunteers is to look forward to being involved and then finding out there isn't as much need for them as possible. But we like to place folks, again, according to their needs, and in that particular program, resources are limited. Resources include, of course, people. Some programs are easier to volunteer for than others. Some are specialized, some take additional education or training, some have a higher level of commitment. And again, we're trying to match what people's interests are and provide the flexibility that they want. Also give them an indication of the impact that they're making. How are they making a difference in that individual's life or in our community life as a whole by their volunteer service? If those things match up, if it matches their need and experience and skills, and if they know they're making a difference, then we're likely to have that person longer term as a volunteer.
Well, we all know that, yeah, one of the best things could ever happen for a senior is to let them stay in their home, something they've done for, 50, 60 years.
Well, it's generally as they wish to remain independent, and again, there are community benefits to that as well.
Let's talk a little more about the Sanford Center. I believe that you have been trying to become more closely associated with the UNR Medical School.
Well, that's a tie that has always existed. We're seeking to strengthen that. We're looking forward to hiring a new long-term director for our program, but we're continuing to engage in the programs that we've been involved with for a number of years. I could tell you about some of those. We're excited about medication therapy management. That provides a review of medications by a particular senior. Folks who are eligible for the program are those 60 and older who are taking 5 or more prescription medications, and it evaluates through a certified geriatric pharmacist whether those medications are safe and effective for their use. Another program that we have that's just about to come out is Elders Count Nevada. It's a statistical analysis of the well-being and general health of Nevada's seniors. That will be coming out in the next month or so. It's both a narrative as well as a statistical look at folks in 6 different areas: in transportation and infrastructure, in economics, in the population and general demographics, and in 3 areas related to healthcare.
Are you involved in this survey concerning seniors in Nevada?
We have other folks. Teresa Sachs is the primary one from the Sanford Center who's leading that effort. It's going to be put out primarily for this legislative session, so that legislators can make effective decisions about prioritizing service and understanding what the needs are and where those needs are greatest.
How are we treating our seniors, Scott, from the viewpoint of federal and local and state? Are seniors being taken care of by our governmental agencies?
Well, I think this statistical report will give more information about that in terms of prioritizing services, because the funding isn't sufficient for the need. Nevada's population is growing proportionally more in that senior population, both within our own state. Those numbers are growing, but relative to other states, it's growing at a faster rate. So we're not presently keeping up with the needs that are there, and therefore prioritization of service, making sure that you're serving the most needy, is one of the present strategies.
How far does the Sanford Center's reach extend? Are you involved in programs in Las Vegas?
Well, the Sanford Center overall touches across the state and can beyond the state boundaries. Some of our programs are statewide by design. Some are more focused geographically. The RSVP program, for instance, is focused geographically on Washoe County, but there are other RSVP programs, one in Carson and the rural areas, and one in Las Vegas and Clark County. So it sort of depends on what program you're talking about in terms of the geographic scope.
What about some of the other programs the Sanford Center is offering?
The GAP program, or Gerontology Academic Program, is one that is growing under the direction of Dr. Sue Harris. And that offers 2 different certification programs for folks studying gerontology. There's the Gerontology Minor, which is a 6-course or 18-credit program. And then the certificate program is a little bit beyond that, 24 units or 8 courses. These are designed for both traditional students to consider this as a minor, gerontology as a minor, as well as programs designed for those who are professionals out in the field who wish to bolster the work that they're doing through that education focus.
Is there really interest in doing gerontology research and getting into that field?
Well, it's interesting because students don't initially come to the university, or I should say most students don't come saying, I really want to study gerontology, I really want to study
The
seniors.
reason I asked the question is, I told you that I worked with Larry Weiss for a number of years, and one of the problems was then getting people in the medical school interested. They didn't want to do gerontology. They wanted to be orthopedic surgeon, and there really wasn't a lot of interest, and I'm wondering if that interest is growing a little bit.
I think under Dr. Harris's direction, it is growing. The visibility is growing. We have, for instance, a surprising number of applicants for a scholarship that the center is going to be offering. More applicants have been submitting applications than we had expected. We also do outreach events. There's a Careers in Aging event that we'll be hosting 2 different days in April. A movie night talking about issues related to aging, and then a Careers in Aging event where folks in the community will be doing roundtable events with prospective students or students who could consider aging as their career. One of the outreach efforts that we're working on is helping students from a variety of majors understand how understanding seniors and their needs would benefit their particular career path, so that a person from College of Business or from political science or things beyond what people traditionally understand as related to aging might understand how their profession would benefit from understanding seniors' needs.
I guess if somebody's coming out of the business school, you mentioned business school, and they become a financial planner, the fact that they've taken some of these courses concerning the elder population, that they're going to be able to talk with them and meet their needs. Better communication.
Or just understand how to communicate effectively with folks in an older age bracket. And we'll have a financial planner at our Careers in Aging event to talk about how their career has benefited by an understanding of seniors.
Tell us again specifically about your medication program and how our audience can take advantage of that.
Again, that's medication therapy management. Folks who are eligible are 60 and older and taking at least 5 medications. They can apply to Teresa Sachs in our department, and she works with a gentleman named Chris Shea, who is a certified geriatric pharmacist. Forwards that information to him. He's going to evaluate that for how these drugs interact with each other, what the dosage levels are, if there have been any other health changes, how easy are the medications to take, what's the cost of these medications, are there alternatives to consider. That pharmacist is going to do a phone consultation with the patient, as well as prepare a report that will go back to the patient, to that patient's regular physician, as well as any specialist, so that there's a full review of all the medications, which not just include the prescription medications, but over-the-counter vitamins and any herbal sort of supplements that that person may be taking.
And when do you expect to have that senior report out? Soon?
Coming in the next month. It's going to be available online through the Sanford Center website, as well as some printed reports, and people should be able to access that in April.
You don't have any pre-information as to how Nevada seniors stack up with people in Ohio?
Well, unfortunately, in many statistical categories, Nevada's social services are lagging behind many other states.
Just like a lot of other services that we have here in the state of Nevada, in youth, teen pregnancy, things like that.
That's right. Many measurements are below national averages.
Tell us one final time here how people can get involved in the RSVP program.
By phone, 784-1807. By our website, go to unr.edu and look for us under the Sanford Center portion. And again, our aim is to engage folks 55 and older in volunteer service.
Thank you for being our guest.
Thank you very much, Bob.
I'm Bob Carroll. We will see you next time.